Question 1. Which of the following is the most important personal protective equipment, PPE, to wear when manually cleaning soiled instruments in the decontamination area? A. Surgical mask. B. Face shield. C. Disposable cap. D. Shoe covers. Answer: B. Face shield. This question tests your knowledge of essential personal protective equipment, PPE, in the decontamination area. The keywords most important and manually cleaning soiled instruments emphasize the need for robust splash protection. When manually cleaning, there is a high risk of splashes, sprays, and aerosols containing blood and other bodily fluids, making a face shield crucial for protecting the eyes, nose, and mouth. For instance, if a technician is scrubbing an instrument, a sudden movement could cause contaminated water to splash onto their face. Always remember, protecting your face is paramount when dealing with potential splashes. Question 2. What is the primary purpose of a Bowie-Dick test? A. To ensure the sterilizer reaches the correct temperature. B. To verify the penetration of steam into porous loads. C. To check the sterilizer's ability to remove air from the chamber. D. To confirm the sterilizer's cycle time is accurate. Answer: C. To check the sterilizer's ability to remove air from the chamber. This question focuses on the specific function of a Bowie-Dick test, a critical quality control measure for dynamic air removal, pre-vacuum, steam sterilizers. The core concept is ensuring proper air removal, which is vital because air pockets prevent steam from reaching and sterilizing instruments effectively. The Bowie-Dick test verifies the sterilizer's vacuum system is functioning correctly to evacuate air from the chamber and porous loads like surgical towels. For example, if air is trapped inside a wrapped instrument set, steam cannot penetrate, and the instruments will not be sterile. Remember, a successful Bowie-Dick test confirms the sterilizer is ready to properly remove air and sterilize porous items. Question 3. What is the correct term for the process of reducing the number of microorganisms on a surface to a safe level? A. Sterilization. B. Disinfection. C. Antisepsis. D. Cleaning. Answer: D. Cleaning. This question tests your understanding of fundamental terminology in sterile processing, specifically distinguishing between different levels of microbial reduction. The concept of reducing the number of microorganisms to a safe level without necessarily eliminating all of them, especially spores, defines cleaning. Cleaning is the physical removal of soil, organic material, and a large number of microorganisms, making items safe to handle for further processing like disinfection or sterilization. For example, washing surgical instruments with detergent and water physically removes blood and tissue, which significantly reduces the microbial load before disinfection or sterilization. Always remember that cleaning is the essential first step, removing the dirt that would otherwise protect microbes from subsequent processes. Question 4. Which of the following is an example of an unacceptable packaging material for steam sterilization? A. Non-woven wrap. B. Peel pouch with paper/plastic combination. C. Woven textile wraps made of 100% cotton. D. Plastic bag. Answer: D. Plastic bag. This question addresses the critical concept of appropriate packaging materials for sterilization. The core idea is that packaging must allow the sterilant, like steam, to penetrate to the instruments while maintaining sterility until use. Ordinary plastic bags are generally unacceptable because they are typically not permeable to sterilizing agents and may melt or degrade during the sterilization process, failing to maintain a sterile barrier. Proper sterilization packaging, such as non-woven wraps or peel pouches, is specifically designed to allow sterilant penetration while resisting tearing and protecting instruments from contamination. For example, using a regular plastic sandwich bag would prevent steam from reaching the instruments inside, leaving them unsterile. Always select packaging designed and validated for the specific sterilization method. Question 5. What is the maximum recommended temperature for the decontamination area? A. 60 degrees Fahrenheit 15.5 degrees Celsius. B. 75 degrees Fahrenheit 24 degrees Celsius. C. 90 degrees Fahrenheit 32 degrees Celsius. D. 100 degrees Fahrenheit 38 degrees Celsius. Answer: B. 75 degrees Fahrenheit 24 degrees Celsius. This question assesses your knowledge of environmental controls within the decontamination area, a crucial aspect of safety and effectiveness in sterile processing. The concept being tested is maintaining appropriate temperature to ensure comfort for staff working in PPE and to prevent rapid drying of bioburden on instruments. The maximum recommended temperature for the decontamination area is 75 degrees Fahrenheit 24 degrees Celsius to help manage staff comfort and reduce the risk of microbial growth while instruments are awaiting processing. If the temperature is too high, it can make wearing personal protective equipment, PPE, uncomfortable for technicians, potentially leading to errors or non-compliance. Keeping the area cool helps ensure a safe and efficient working environment. Question 6. What is the correct action to take if a rigid sterilization container falls on the floor in the sterile storage area? A. Reprocess the container immediately. B. Visually inspect for damage and continue storage if none is found. C. Place a Do Not Use label on it and return it to decontamination. D. Clean the outside of the container with an antiseptic wipe and return to storage. Answer: C. Place a Do Not Use label on it and return it to decontamination. This question tests your understanding of maintaining sterility and proper handling of compromised items. The concept is that any event that could compromise the sterile barrier, such as a drop, renders the item unsterile, even if visible damage is not present. The Do Not Use label signifies its compromised status, and returning it to decontamination ensures it will undergo the full reprocessing cycle, cleaning, inspection, packaging, and sterilization, before it can be used again. For example, a hidden crack in the container or a loose seal could allow microorganisms to enter, making the instruments unsafe for patient use. When in doubt about sterility, always reprocess. Question 7. Which government agency regulates the manufacture and sale of sterilants and disinfectants? A. Occupational Safety and Health Administration, OSHA. B. Centers for Disease Control and Prevention, CDC. C. Environmental Protection Agency, EPA. D. Food and Drug Administration, FDA. Answer: C. Environmental Protection Agency, EPA. This question focuses on regulatory bodies and their specific roles in sterile processing. The concept is understanding which agency has jurisdiction over chemical products used for killing microorganisms. The Environmental Protection Agency, EPA, is responsible for regulating the manufacture and sale of disinfectants and sterilants, ensuring their effectiveness claims are validated and that they are safe for use as directed. For example, if a manufacturer claims a chemical product can kill a specific bacterium, the EPA reviews the data to verify that claim before the product can be sold. Remember that the EPA primarily governs environmental aspects, including the chemicals we use to disinfect surfaces and instruments. Question 8. What is the ideal humidity range for the sterile storage area? A. 20% to 30%. B. 30% to 60%. C. 60% to 70%. D. 70% to 80%. Answer: B. 30% to 60%. This question assesses knowledge of environmental controls in the sterile storage area, which is crucial for maintaining the integrity of sterile packages. The concept is that humidity levels can impact the sterility of items. Too low can dry out packaging and make it brittle, while too high can promote microbial growth or compromise package integrity. The ideal humidity range of 30% to 60% is recommended to prevent sterile packaging from becoming too dry and brittle, which could lead to tears, or too moist, which could promote bacterial growth. For instance, if humidity is too high, moisture can wick through sterile wrappers, potentially contaminating the contents. Maintaining proper environmental conditions helps ensure items remain sterile until needed. Question 9. What is the purpose of performing a leak test on a flexible endoscope? A. To assess the optical clarity of the scope. B. To check for electrical conductivity. C. To detect damage to the insertion tube that could lead to fluid invasion. D. To measure the scope's working length. Answer: C. To detect damage to the insertion tube that could lead to fluid invasion. This question targets a specific and critical step in flexible endoscope reprocessing. The concept of a leak test is to identify any breaks or pinholes in the outer sheath of the endoscope before manual cleaning and high-level disinfection. Early detection of leaks is vital because fluid entering the scope's internal channels during reprocessing can cause irreparable damage to delicate electronics and optics, leading to expensive repairs and potential patient safety issues if the scope is not functioning correctly. For example, a small puncture could allow water and cleaning solution inside, corroding components. Performing a leak test is your first line of defense in protecting these costly and complex instruments. Question 10. When transporting soiled instruments from the operating room to the decontamination area, which of the following is most important? A. Instruments should be completely dry. B. Instruments should be placed in a clear, labeled bag. C. Instruments should be enclosed in a closed container. D. Instruments should be sorted by type. Answer: C. Instruments should be enclosed in a closed container. This question focuses on safe transportation practices for contaminated items, a key infection control principle. The core concept is containing contaminants to prevent exposure to staff and the environment during transport. Placing soiled instruments in a closed container, often referred to as a biohazard container or transport cart, prevents spillage of blood and body fluids and minimizes aerosolization of microorganisms. For example, transporting an open tray of instruments could lead to accidental spills or exposure to airborne pathogens. Always ensure all contaminated items are securely contained to protect everyone in the facility. Question 11. What is the function of the suction line in a steam sterilizer? A. To remove steam after the sterilization phase. B. To draw a vacuum for air removal prior to steam injection. C. To add moisture to the chamber. D. To circulate steam during the exposure phase. Answer: B. To draw a vacuum for air removal prior to steam injection. This question delves into the mechanics of a dynamic air removal, pre-vacuum, steam sterilizer. The concept is understanding how air is removed from the chamber to ensure proper steam penetration. The suction line, connected to a vacuum pump, is responsible for drawing a vacuum, effectively pulling air out of the sterilizer chamber and the instrument loads. This vacuum is crucial because air is a barrier to steam, and if not removed, can prevent instruments from becoming sterile. For example, if the vacuum pump malfunctions, air pockets will remain, leading to incomplete sterilization. Think of the suction line as the lung of the sterilizer, breathing out air so steam can fully penetrate. Question 12. What term describes the absence of all pathogenic microorganisms? A. Asepsis. B. Antisepsis. C. Disinfection. D. Sanitization. Answer: A. Asepsis. This question tests your understanding of foundational infection control terminology. The concept of asepsis refers to the absence of disease-producing microorganisms or contamination. It's a broader term encompassing practices and procedures performed to prevent contamination. For instance, creating a sterile field in an operating room is an example of maintaining asepsis to prevent microorganisms from reaching the patient's surgical site. While other terms involve reducing microbes, asepsis implies maintaining an environment free of pathogens. Keep in mind that asepsis is the goal of sterile processing, to make and keep items free from harmful germs. Question 13. Which class of chemical indicators is used to monitor conditions inside each package, reacting to multiple critical parameters? A. Class 1. B. Class 2. C. Class 3. D. Class 5. Answer: D. Class 5. This question focuses on the different classes of chemical indicators, a key component of sterilization monitoring. The concept is understanding that Class 5 indicators are designed as integrators, meaning they react to all critical parameters of a sterilization cycle, time, temperature, and saturated steam for steam sterilization, and are placed inside each package to confirm that the sterilizing conditions were met at the point of use. For example, a Class 5 integrator placed within a wrapped instrument tray will change color only if the steam reached the appropriate temperature for the correct duration with sufficient moisture inside that specific package. Remember, Class 5 is your go-to for confirming conditions within the package. Question 14. What is the recommended method for cleaning the inside lumen of a complex surgical instrument? A. Soaking in an enzymatic solution only. B. Flushing with sterile water followed by air drying. C. Using a small, soft brush and flushing with enzymatic solution. D. Wiping the exterior with a disinfectant wipe. Answer: C. Using a small, soft brush and flushing with enzymatic solution. This question addresses the critical process of manual cleaning for instruments with lumens, which are internal channels. The concept is that physical friction combined with the appropriate chemical is essential for effective cleaning, especially for removing bioburden from hard-to-reach internal surfaces. Using a small, soft brush, specifically designed for lumens, along with flushing with an enzymatic solution, mechanically removes organic material and biofilms, ensuring thorough cleaning. For example, if a cannula, a tube-like instrument, is only soaked, blood clots inside might not be dislodged. Always remember, if you can't see it, you must still physically clean it, often with a brush and flushing. Question 15. How often should biological indicators, BICE, be used for routine monitoring of steam sterilizers? A. Once a day. B. Once a week. C. Once a month. D. Every load. Answer: A. Once a day. This question tests your knowledge of routine sterilization monitoring practices, specifically for steam sterilizers. The concept is that biological indicators provide the highest level of assurance of sterilization effectiveness by directly testing the sterilizer's ability to kill highly resistant bacterial spores. For routine monitoring, biological indicators should be run at least once a day, preferably in the first full load, to ensure the sterilizer is functioning correctly. For example, if the daily BI shows a positive result, it indicates a sterilization failure, and the sterilizer must be taken out of service until repaired and retested. A daily BI is your primary guardian of sterilization efficacy. Question 16. What is the first step in the cycle for an automated endoscope reprocessor, AER? A. High-level disinfection. B. Rinse. C. Leak test. D. Wash/pre-rinse. Answer: D. Wash/pre-rinse. This question assesses your understanding of the automated reprocessing steps for flexible endoscopes. The concept is that thorough cleaning must always precede high-level disinfection to ensure the disinfectant can properly contact all surfaces and be effective. The first step in an automated endoscope reprocessor (AER) cycle is typically a wash or pre-rinse phase, which helps to remove any remaining organic material and cleaning solution from the manual cleaning process. For example, if an endoscope still has protein residue, the high-level disinfectant won't be able to reach and kill all microorganisms. Always remember that proper cleaning is the foundation for effective disinfection. Question 17. What type of water is generally recommended for the final rinse of instruments after manual cleaning? A. Tap water. B. Distilled water. C. Deionized (DI) water. D. Sterile water. Answer: C. Deionized (DI) water. This question focuses on the quality of water used in instrument processing, a critical factor in preventing instrument damage and ensuring effective sterilization. The concept is that minerals and impurities in water can cause spots, stains, or corrosion on instruments, especially after high temperatures. Deionized (DI) water is recommended for the final rinse because it has had most of its mineral ions removed, which helps prevent water spots, staining, and corrosion on instruments. For example, using tap water, which contains minerals, can leave white spots on instruments after drying, potentially interfering with sterilization or causing instrument damage over time. Using DI water for the final rinse helps keep your instruments looking good and performing properly. Question 18. What is the primary reason for proper instrument inspection after cleaning and before packaging? A. To count the instruments for inventory. B. To verify the surgeon's preferences. C. To detect any remaining soil or damage. D. To apply lubricant to all instruments. Answer: C. To detect any remaining soil or damage. This question highlights a crucial quality assurance step in the preparation and packaging area. The concept is that instruments must be meticulously clean and functional before sterilization to ensure patient safety and effective use. The primary reason for inspecting instruments after cleaning is to detect any remaining soil, which can harbor microorganisms and prevent sterilization, or any damage like cracks or dullness, which can impact surgical performance. For example, if a small piece of tissue remains hidden on an instrument, the sterilization process might not be effective at that spot. Thorough inspection is your last chance to catch issues before sterilization, safeguarding both patients and instruments. Question 19. Which of the following is a key characteristic of an effective sterile storage area? A. Open shelving to promote air circulation. B. Located near high-traffic areas for easy access. C. Controlled temperature and humidity. D. Direct sunlight exposure to inhibit microbial growth. Answer: C. Controlled temperature and humidity. This question addresses the environmental requirements for maintaining the sterility of processed medical devices. The core concept is that temperature and humidity levels directly impact the integrity of sterile packaging and the longevity of sterile items. A controlled temperature and humidity environment helps prevent package degradation, such as paper becoming brittle or plastic delaminating, and reduces the risk of condensation or microbial growth. For example, if the storage area is too hot and humid, paper plastic pouches might seal prematurely or become compromised. Proper environmental controls are essential for ensuring that items remain sterile until their expiration date. Question 20. What is the recommended method for cleaning an instrument with a cutting edge, such as scissors or an osteotome? A. Rubbing the cutting edge with a stiff brush. B. Wiping the cutting edge with a cloth. C. Brushing away from the sharp edge under water. D. Immersing in an ultrasonic cleaner only. Answer: C. Brushing away from the sharp edge under water. This question specifically addresses safe handling and cleaning of sharp instruments, which is critical for technician safety. The concept is to protect yourself from sharp injuries while ensuring effective cleaning. When cleaning instruments with cutting edges, you should always brush away from the sharp edge underwater to prevent splashes and to minimize the risk of accidental cuts or punctures. For instance, if you brush towards yourself, you could slip and cut your hand. Always prioritize your safety by brushing away from yourself and keeping sharps submerged to prevent aerosolizing contaminants. Question 21. What information must be included on a sterile package label? A. Patient's name and date of birth. B. Sterilization date, sterilizer identification, and cycle number. C. Surgeon's name and procedure type. D. Purchase date and vendor information. Answer: B. Sterilization date, sterilizer identification, and cycle number. This question focuses on the essential information required for traceability and recall in sterile processing. The concept is that every sterile package must be identifiable to track its sterilization process and to allow for effective recall if a problem is detected. Including the sterilization date, sterilizer identification, which machine was used, and cycle number ensures that if there's a sterilization failure or recall, all affected items can be quickly identified and removed from circulation. For example, if a biological indicator fails, knowing the cycle number allows you to pull all items processed in that specific cycle. This critical information ensures patient safety through traceability. Question 22. Which type of sterilization uses ethylene oxide, EDO? A. High-temperature sterilization. B. Low-temperature sterilization. C. Flash sterilization. D. Dry heat sterilization. Answer: B. Low-temperature sterilization. This question tests your knowledge of different sterilization modalities. The concept is that certain heat-sensitive instruments require sterilization methods that operate at lower temperatures to prevent damage. Ethylene oxide, EDO, is a gaseous sterilant used for heat and moisture-sensitive instruments, and it operates at much lower temperatures than steam sterilization. For example, if a delicate camera or a plastic component cannot withstand the high heat of steam, EDO offers an effective alternative. Remember that EDO is a low-temperature sterilization method, crucial for preserving delicate medical devices. Question 23. What is a common cause of sterilization failures in wrapped instrument sets? A. Using too much linen. B. Overloading the sterilizer chamber. C. Placing chemical indicators incorrectly. D. Using instruments that are too old. Answer: B. Overloading the sterilizer chamber. This question addresses a frequent issue that compromises the effectiveness of sterilization. The concept is that proper sterilant penetration relies on adequate space and uniform exposure within the sterilizer chamber. Overloading the sterilizer chamber creates dense loads where steam or other sterilants cannot circulate freely and reach all surfaces of the instruments, leading to areas that do not achieve sterility. For example, if you pack too many instrument sets into a sterilizer, the innermost packages might not be adequately sterilized. Always ensure there is enough space between packages in the sterilizer to allow for proper sterilant penetration and air removal. Question 24. What is the term for an inanimate object that can transmit infectious agents from one person to another? A. Vector. B. Reservoir. C. Fomite. D. Host. Answer: C. Fomite. This question tests your understanding of the chain of infection, a fundamental concept in infection prevention. The concept of a fomite refers to any inanimate object, like instruments, linens, or even door handles, that can become contaminated with infectious microorganisms and serve as a means of transmission. For example, if a contaminated surgical instrument is not properly cleaned and sterilized, it can act as a fomite, transferring pathogens to the next patient. Understanding fomites is critical in sterile processing because our primary goal is to break this link in the chain of infection by ensuring all reusable medical devices are properly reprocessed. Question 25. Which agency establishes guidelines for environmental control in the sterile processing department, including air exchanges and temperature? A. Food and Drug Administration, FDA. B. American National Standards Institute, ANSI. C. Association for the Advancement of Medical Instrumentation, AAMI. D. Occupational Safety and Health Administration, OSHA. Answer: C. Association for the Advancement of Medical Instrumentation, AAMI. This question identifies a key professional organization that provides comprehensive guidance for sterile processing operations. The concept is that organizations like AAMI develop recommended practices and standards that facilities voluntarily adopt to ensure safety and quality in medical device reprocessing. AAMI provides detailed guidelines for environmental controls, such as air exchanges, temperature, and humidity, for all areas within the sterile processing department, including decontamination, prep and pack, and sterile storage. For example, AAMI standards specify the minimum air exchanges required in the decontamination area to manage airborne contaminants. Always look to AAMI for best practices in SPD environmental control. Question 26. What is the purpose of placing absorbent material at the bottom of a rigid sterilization container? A. To absorb condensation during the sterilization cycle. B. To prevent instruments from rattling. C. To provide a barrier against external contamination. D. To indicate sterility after the cycle. Answer: A. To absorb condensation during the sterilization cycle. This question addresses a specific practice in preparing rigid sterilization containers. The concept is managing moisture within the container during steam sterilization to ensure instruments dry properly and remain sterile. Absorbent material, often referred to as a container filter or sterilization mat, is placed at the bottom of a rigid sterilization container to absorb any condensation that may form during the steam sterilization cycle, which helps the instruments dry completely. If instruments remain wet, they can become recontaminated as water can wick microorganisms through the container filter. Ensuring instruments are dry is essential for maintaining sterility, so this absorbent material is a key component. Question 27. What should be done with instruments contaminated with Creutzfeldt-Jakob disease, CJD, after use? A. Routine cleaning and sterilization can be performed. B. They require special decontamination and extended sterilization cycles. C. They should be discarded immediately as biohazard waste. D. They only need high-level disinfection. Answer: B. They require special decontamination and extended sterilization cycles. This question highlights a unique and highly resistant infectious agent that requires specific reprocessing protocols. The concept is that prion, the infectious agents causing CJD, are extremely resistant to conventional sterilization methods. Instruments used on CJD suspected or confirmed patients require special decontamination procedures, including specific cleaning protocols and extended sterilization cycles, e.g., increased temperature and/or time for steam sterilization, to ensure prion inactivation. For example, standard 270 degrees Fahrenheit 132 degrees Celsius steam sterilization for 4 minutes is insufficient for prion, often requiring longer cycles like 18 minutes at that temperature. Always follow specific facility policies and guidelines for CJD instruments, as they pose a unique challenge. Question 28. What is the primary advantage of using an ultrasonic cleaner for surgical instruments? A. It can sterilize instruments. B. It provides automated high-level disinfection. C. It removes fine debris from hard-to-reach areas. D. It polishes instruments to a shine. Answer: C. It removes fine debris from hard-to-reach areas. This question focuses on the specific benefits of ultrasonic cleaning in the decontamination process. The concept is that cavitation, the process used by ultrasonic cleaners, is highly effective at dislodging microscopic soil from complex surfaces. An ultrasonic cleaner uses high-frequency sound waves to create microscopic bubbles that implode, cavitation, effectively dislodging fine debris, blood, and tissue from intricate instrument crevices and lumens that are difficult to reach manually. For example, a small bone rongeur with many tiny serrations will benefit greatly from ultrasonic cleaning. Think of it as a powerful, non-abrasive scrubbing action that reaches where brushes cannot. Question 29. Which organization sets the standards for fire safety in healthcare facilities? A. Occupational Safety and Health Administration, OSHA. B. National Fire Protection Association, NFPA. C. The Joint Commission, TJC. D. Centers for Medicare and Medicaid Services, CMS. Answer: B. National Fire Protection Association, NFPA. This question addresses a critical safety aspect within the healthcare environment. The concept is that specific organizations are dedicated to setting standards for various safety domains. The National Fire Protection Association, NFPA, develops and publishes codes and standards for fire prevention and safety, including those applicable to healthcare facilities. For example, the NFPA 101, Life Safety Code, provides requirements for safe egress from buildings and fire protection features. Knowing NFPA's role is key to understanding and implementing fire safety protocols in the sterile processing department. Question 30. After a steam sterilization cycle, packages should be allowed to cool on the sterilizer cart before being moved. Why? A. To prevent condensation from forming inside the packages. B. To allow the chemical indicator to fully change color. C. To prevent recontamination from moist hands. D. To prevent damage to the sterilizer. Answer: A. To prevent condensation from forming inside the packages. This question tests your understanding of proper post-sterilization handling. The concept is that rapid temperature changes can compromise the sterility of packages. Allowing packages to cool gradually on the sterilizer cart helps prevent condensation from forming inside the packages, which can lead to a phenomenon called wet pack and compromise sterility. For example, if a hot sterile package is placed on a cold surface, moisture can condense inside, potentially wicking bacteria from the outside in. Proper cooling ensures that packages remain dry and sterile, preserving their integrity. Question 31. What is the purpose of surgical instrument lubricants, also known as milks? A. To clean the instruments. B. To prevent corrosion and restore articulation. C. To sterilize the instruments. D. To add a protective coating during storage. Answer: B. To prevent corrosion and restore articulation. This question focuses on the function of a specific chemical used in instrument processing. The concept is that instruments, especially those with moving parts, require maintenance to ensure their longevity and proper function. Surgical instrument lubricants are applied after cleaning and rinsing, but before sterilization, to prevent corrosion, rust, and to restore smooth articulation or movement in hinged instruments like scissors or clamps. For example, if a pair of surgical scissors is not lubricated, the joint might become stiff, making them difficult to open and close during surgery. Lubricating instruments helps extend their lifespan and ensures they perform correctly. Question 32. Which of the following is the most effective way to remove dried blood from surgical instruments? A. Soaking in hot water. B. Wiping with a dry cloth. C. Soaking in an enzymatic detergent. D. Rinsing under cold tap water. Answer: C. Soaking in an enzymatic detergent. This question targets the optimal method for initial cleaning, especially with challenging soil. The concept is that enzymatic detergents break down organic matter, making dried bioburden easier to remove. Soaking instruments with dried blood in an enzymatic detergent allows the enzymes to break down proteins and other organic matter, effectively loosening the dried soil and making it much easier to remove during subsequent manual or automated cleaning. For example, if dried blood is simply rinsed with cold water, it often remains stubbornly attached. Enzymatic detergents are formulated specifically to tackle tough organic residues. Question 33. What is the correct term for the physical removal of all visible soil and organic material from an item? A. Disinfection. B. Sterilization. C. Decontamination. D. Cleaning. Answer: D. Cleaning. This question tests your understanding of the foundational step in sterile processing. The concept is that cleaning is the essential first step in reprocessing, focusing on the physical removal of visible debris. Cleaning involves the removal of all visible soil, such as blood, tissue, and other organic matter, from instruments and equipment. This physical removal is crucial because visible soil can harbor microorganisms and interfere with the effectiveness of subsequent disinfection or sterilization processes. For example, if a surgical clamp still has dried blood on it after initial processing, disinfectants or sterilants may not be able to penetrate and kill all microorganisms. Cleaning is always the first and most vital step. Question 34. What is the primary purpose of a traceability system in sterile processing? A. To track employee work hours. B. To follow the location of individual instruments. C. To link a reprocessed medical device to a specific patient. D. To monitor the department's budget. Answer: C. To link a reprocessed medical device to a specific patient. This question addresses a critical quality assurance and patient safety concept in sterile processing. The concept of traceability is the ability to track a medical device from its point of use on a patient, through the entire reprocessing cycle, and back to another patient, or to identify which patients received a device from a particular sterilization load. This linking is vital for patient safety, allowing facilities to quickly identify and recall items or patients exposed to potentially compromised devices if a reprocessing error or recall occurs. For example, if a sterilizer malfunctions, traceability allows the facility to identify all patients who received instruments from that specific load. Traceability is about ensuring accountability and safety for every device and every patient. Question 35. What is the proper orientation for placing peel pouches in a sterilizer? A. Stacked flat on top of each other. B. On edge, paper to plastic, allowing air removal and steam penetration. C. Randomly placed to maximize space. D. With the plastic side facing up. Answer: B. On edge, paper to plastic, allowing air removal and steam penetration. This question tests your knowledge of proper loading techniques for sterilization, which is essential for ensuring effective sterilant penetration. The concept is that proper loading maximizes exposure of items to the sterilizing agent. Peel pouches should be placed on edge, with the paper side facing the plastic side of an adjacent pouch, allowing for efficient air removal and proper steam penetration. For example, if peel pouches are stacked flat, air can become trapped between them, preventing steam from reaching all surfaces and leading to an unsterile outcome. Proper loading ensures that every item receives adequate sterilant exposure. Question 36. Which type of instrument is generally considered critical according to the Spalding classification system? A. Blood pressure cuff. B. Endoscope, flexible. C. Surgical scalpel. D. Stethoscope. Answer: C. Surgical scalpel? This question tests your understanding of the Spalding classification system, a fundamental concept in infection control that guides reprocessing decisions. The concept is that instruments are classified based on the risk of infection they pose. A critical instrument is one that enters sterile tissue or the vascular system and, therefore, must be sterile. A surgical scalpel directly punctures and cuts sterile tissue, thus it is classified as critical and requires sterilization. For example, a scalpel used in an operation must be completely free of all microorganisms to prevent infection at the surgical site. Critical items must be sterile. Question 37. What is the main reason for rinsing instruments under cool water immediately after a surgical procedure? A. To remove strong odors. B. To prevent the drying of blood and organic material. C. To cool down hot instruments. D. To begin the disinfection process. Answer: B. To prevent the drying of blood and organic material. This question addresses immediate point-of-use cleaning, a critical first step in the reprocessing cycle. The concept is that keeping bioburden moist prevents it from drying and adhering to the instrument surface, making it much easier to remove later. Rinsing instruments under cool water immediately after use helps prevent blood, tissue, and other organic material from drying onto the instrument surfaces, which makes subsequent cleaning much more difficult. For example, dried blood can bake onto an instrument, requiring extensive scrubbing or special soaking. Keeping instruments moist at the point of use significantly improves the efficiency of the decontamination process. Question 38. What is the typical shelf life of a sterile item wrapped in woven textile wrap? A. Indefinite, as long as the package is intact. B. Event-related, dependent on the integrity of the package. C. 30 days from the date of sterilization. D. 1 year from the date of sterilization. Answer: B. Event-related, dependent on the integrity of the package. This question focuses on the concept of sterile shelf life. The key phrase event-related means that the sterility of an item is maintained as long as the integrity of its packaging is not compromised, regardless of how much time has passed. Unlike date-related shelf life, event-related sterility means that a package remains sterile until an event occurs that compromises its integrity, such as being dropped, getting wet, or having a torn wrapper. For example, a wrap tray sterilized a year ago is still considered sterile if its packaging is dry, intact, and free of punctures. Always inspect packages carefully. If the barrier is breached, it's no longer sterile. Question 39. What is the primary role of a heat sealer for peel pouches? A. To sterilize the contents of the pouch. B. To create a secure, impervious seal on the pouch. C. To label the pouch with sterilization information. D. To dry the instruments inside the pouch. Answer: B. To create a secure, impervious seal on the pouch. This question focuses on the critical function of specific equipment used in packaging. The concept is that a sterile barrier relies on an effective and intact seal. A heat sealer is used to create a secure, impervious seal on peel pouches, ensuring that the contents remain sterile until the pouch is opened at the point of use. For example, if a pouch is not properly sealed, microorganisms can enter, compromising the sterility of the instruments inside. A strong, consistent seal is essential for maintaining the sterility of packaged items. Question 40. Which of the following defines high-level disinfection? A. Killing all microorganisms, including bacterial spores. B. Killing all vegetative bacteria, fungi, and some viruses, but not spores. C. Killing all microorganisms except bacterial spores and prion. D. Reducing the number of microorganisms to a safe level. Answer: C. Killing all microorganisms except bacterial spores and prion. This question tests your precise understanding of different levels of microbial inactivation. The concept is that high-level disinfection effectively kills a broad range of microorganisms, including most bacteria, fungi, and viruses, but it is not guaranteed to kill all bacterial spores or prion. For example, a flexible endoscope, which is often high-level disinfected, is safe for use because the process eliminates harmful pathogens but does not necessarily render it fully sterile like a surgical scalpel would be. Remember that high-level disinfection is a step below sterilization. It's a very high level of germ killing, but not complete spore elimination. Question 41. What is the primary reason for performing a DART, daily air removal test, on a pre-vacuum steam sterilizer? A. To test the sterilizer's temperature accuracy. B. To confirm effective air removal from the chamber. C. To ensure proper steam penetration into lumens. D. To verify the cycle time is correct. Answer: B. To confirm effective air removal from the chamber. This question targets a specific routine test for pre-vacuum steam sterilizers. The concept is that efficient air removal is paramount for steam sterilization effectiveness. The daily air removal test, DART, also commonly known as a Boedict test, is specifically designed to detect inefficient air removal or the presence of non-condensable gases in the pre-vacuum sterilizer chamber. For example, if there's an air leak into the chamber, the DART will show a failed result, indicating that steam may not be reaching all parts of the load. This test is crucial for ensuring that the sterilizer is consistently capable of providing adequate steam penetration. Question 42. What is the maximum weight recommended for a surgical instrument set that will be steam sterilized? A. 10 pounds, 4.5 kilograms. B. 15 pounds, 6.8 kilograms. C. 25 pounds, 11.3 kilograms. D. 50 pounds, 22.7 kilograms. Answer: C. 25 pounds, 11.3 kilograms. This question assesses your knowledge of best practices for instrument set preparation, impacting both effectiveness and ergonomics. The concept is that excessively heavy sets can impede sterilant penetration and pose a risk of injury to staff. The maximum recommended weight for a surgical instrument set, including the container, is generally 25 pounds, 11.3 kilograms, to ensure proper steam penetration during sterilization and to reduce ergonomic stress and injury risk for sterile processing technicians. For example, a set heavier than 25 pounds might be too dense for steam to fully penetrate all instruments, potentially leading to an unsterile outcome. Always adhere to weight limits for effective sterilization and staff safety. Question 43. What is the correct way to handle a torn sterile wrapper found on an instrument tray in sterile storage? A. Tape the torn area and return it to storage. B. Place a do not use label on it and send it for reprocessing. C. Remove the inner wrapper and use the instruments. D. Discard the entire tray as biohazard waste. Answer: B. Place a do not use label on it and send it for reprocessing. This question addresses the critical principle of maintaining sterility and proper action when a sterile barrier is compromised. The concept is that any breach in a sterile barrier renders the contents unsterile, regardless of how small the tear. A torn wrapper compromises the sterility of the instrument tray, meaning it must be considered unsterile, labeled clearly as do not use, and returned to the decontamination area for full reprocessing. For example, even a tiny tear could allow microorganisms to enter the package. When the integrity of the sterile barrier is in question, always assume it's unsterile and reprocess it. Question 44. What is the primary function of the SPD, Sterile Processing Department, in a healthcare facility? A. To perform patient diagnoses. B. To provide direct patient care. C. To clean, sterilize, and manage medical and surgical instruments. D. To manage hospital finances. Answer: C. To clean, sterilize, and manage medical and surgical instruments. This question tests your fundamental understanding of the core mission of the Sterile Processing Department. The concept is that SPD is the central hub responsible for ensuring the safety and readiness of reusable medical devices. The primary function of the SPD is to clean, inspect, package, sterilize, and manage the inventory of reusable medical and surgical instruments and equipment, ensuring they are safe and ready for patient use. For example, every surgical instrument used in an operating room must pass through the SPD for proper reprocessing before it can be used again. SPD is the backbone of patient safety, providing sterile instruments for every procedure. Question 45. Which of the following is a key characteristic of the decontamination area's ventilation system? A. Positive air pressure. B. Negative air pressure. C. Recirculated air. D. Air filtered through HEPA filters only. Answer: B. Negative air pressure. This question addresses crucial environmental controls in the decontamination area. The concept is that negative air pressure is used to contain contaminants within this soiled area and prevent them from spreading to cleaner areas. The decontamination area should maintain negative air pressure, meaning that air flows into this area from adjacent clean areas rather than out, effectively containing airborne contaminants like microorganisms and aerosols within the soiled room. For example, if you open the door to the decontamination area, the air from the hallway should flow into the room, not out into the hallway. This setup is vital for preventing the spread of contamination throughout the department. Question 46. What is the purpose of placing a chemical indicator inside every instrument tray or package? A. To verify that the contents are sterile. B. To confirm that the sterilant reached the inside of the package. C. To monitor the overall sterilizer performance. D. To indicate the expiration date of the package. Answer: B. To confirm that the sterilant reached the inside of the package. This question focuses on the critical role of internal chemical indicators in ensuring effective sterilization. The concept is that an internal indicator provides immediate evidence that the sterilizing agent penetrated the package and reached the instruments inside. Placing a chemical indicator inside every instrument tray or package provides an immediate visual confirmation that the sterilizing agent, such as steam, actually penetrated the package and contacted the instruments. For example, if a chemical indicator doesn't change color as expected, it alerts staff that the instruments inside that specific package may not have been exposed to the proper sterilizing conditions. This inside check is a vital part of release criteria for sterile items. Question 47. Which type of sterilizer uses peracetic acid as its sterilant? A. Steam sterilizer. B. Ito sterilizer. C. Plasma sterilizer. D. Dry heat sterilizer. Answer: C. Plasma sterilizer. This question tests your knowledge of various low-temperature sterilization methods. The concept is that different sterilants are used in specific low-temperature processes suitable for heat and moisture-sensitive instruments. Plasma sterilizers, often referred to as hydrogen peroxide gas plasma sterilizers, use hydrogen peroxide in a gas plasma state to effectively sterilize instruments at low temperatures. For example, delicate surgical instruments or electronics that cannot withstand the high heat and moisture of steam sterilization can be safely processed using a plasma sterilizer. Remember that hydrogen peroxide plasma is a distinct low-temperature sterilization method. Question 48. What is the proper method for storing sterile supplies? A. On the floor, away from walls. B. On open shelving units near windows. C. On enclosed shelving or carts, away from walls, ceilings, and floors. D. In cardboard boxes stacked high to save space. Answer C. On enclosed shelving or carts, away from walls, ceilings, and floors. This question focuses on the essential principles of maintaining sterility during storage. The concept is that sterile items must be protected from environmental contaminants and physical damage. Proper storage requires placing sterile supplies on enclosed shelving or carts, at least 8 to 10 inches off the floor, 18 inches from the ceiling, and 2 inches from walls, to protect them from dust, moisture, and temperature fluctuations. For example, storing items on the floor increases the risk of contamination from spills or foot traffic. Following these guidelines helps ensure the continued sterility of medical devices until they are needed. Question 49. What action should be taken if a sterilization load fails a biological indicator (BI) test? A. Release all items from the load, but retest the sterilizer. B. Reprocess all items from that specific load, after the sterilizer is retested successfully. C. Only reprocess the items from the BI test pack. D. Continue using the sterilizer as normal, but monitor closely. Answer B. Reprocess all items from that specific load, after the sterilizer is retested successfully. This question addresses a critical response to a sterilization failure, impacting patient safety directly. The concept is that a failed biological indicator means all items in that specific load must be considered unsterile. If a sterilization load fails a biological indicator test, all items from that specific load must be recalled, considered unsterile, and reprocessed only after the sterilizer has been retested with a passing BI and determined to be functioning correctly. For example, if a BI from a morning load turns positive, every instrument tray, peel pouch, and rigid container from that load must be removed from circulation and re-sterilized. A failed BI is a serious alert, signaling that patient safety may have been compromised. Question 50. Which of the following is the most important practice to prevent musculoskeletal injuries in the sterile processing department? A. Wearing comfortable shoes. B. Using proper body mechanics and lifting techniques. C. Taking frequent short breaks. D. Keeping the work area brightly lit. Answer B. Using proper body mechanics and lifting techniques. This question highlights a key aspect of occupational safety, vital for the long-term health of SPD technicians. The concept is that ergonomics and safe lifting practices are essential to prevent strain and injury from repetitive tasks and heavy loads. Using proper body mechanics and lifting techniques, such as lifting with your legs instead of your back, maintaining a neutral spine, and seeking assistance with heavy items, is the most important practice to prevent musculoskeletal injuries in the SPD. For example, repeatedly lifting heavy instrument trays incorrectly can lead to chronic back pain or shoulder injuries. Prioritizing correct posture and lifting methods protects your body from harm over time.